My name is Hoa-Yen Trinh. I did my research on dementia and considering the biological sexes in the development of dementia. So, a little bit about me. I am a senior in high school in Boston, Massachusetts. I did my uh, research on dementia because I'm very interested in neuroscience. And I did with my mentor, Christian Cesares. I enjoy learning about neuroscience and brain behaviors, how the brain um, it takes in all of our experiences and how that affects us as people. So, what is dementia? Dementia is a neurodegenerative disease characterized by patients' impaired judgment and memory, currently thought to be caused by excess non-functioning protein growth, affecting about 10.7% of people over the age of 65 worldwide, about 55 million people. It is an incurable disease that has financial and social impacts on many families on a global scale. Dementia also encompasses different diseases, and its most common form is Alzheimer's disease, and there are other diseases like Huntington's disease and vascular dementia. Treatments right now include medicines and therapies that you could do. However, it is unknown the efficacies of these treatments um, and how they relate to demographic information such as biological sex. These factors are additional challenges to scientists and which have to consider when researching and producing treatments for the disease. So, what are the methods used in determining the sex differences in the development of dementia? For my research, I used data from the Aging, Dementia, and TBI study from the Allen Institute for Brain Science, and I looked at a variety of patient cognitive assessments to evaluate biological sex difference in the development of dementia. I specifically looked at Braak staging and NIA reagent methods as a metric of the risk of developing dementia. The NIA region's neuropathologic criteria, which relies on neurofibrillary tangles and neuritic plaques, ranges from the lowest to highest value based on the amount of each non-functioning protein in the brain. Braak staging, on the other hand, goes from stages 1 to 4, evaluating the progression of neurofibrillary tangle growth within the medial temporal lobe memory circuit from the lowest to highest stage. I used the average values of both tests for each demographic, male and female, and created bar graphs that visually show the differences. I also focused on the temporal cortex's deterioration as an additional metric and measured the average alpha-synuclein proteins in the area. Each comparison between males and females also underwent a student's two-sample t-test to determine if the data was significant or statistically significant as well. So for my first result, my first bar graph determines the difference between males and females in Braak stages. The amount of neurofibrillary tangles in the brain determines one Braak stage, as said previously, and the higher the Braak stage, the more neurofibrillary tangles one has. The average Braak stage value for females was higher than for males, and it was found that the data was statistically significant. And in figure 2, it determines the difference between males and females using the NIA region criteria. The criteria uses neurofibrillary tangles and neuritic plaques to determine the chance of someone developing dementia and a higher value means a higher chance a person has to developing the disease. The average NIA reagent value for females was higher than males. However, the data was not statistically significant based on the p-value found during the t-test. For my third bar graph, this measures the neurological deterioration of the medial cortex using the average alpha-synuclein proteins in that region. These alpha-synuclein proteins are abnormal protein deposits that build up in the brain over time, causing a neurological dysfunction. And females have a higher average of alpha-synuclein proteins than males, but again, the data was found to not be statistically significant due to the p-value of the t-test that was found. So what do these results mean? Females have greater amounts of neurofibrillary tangles and neuritic plaques, as seen on the NI reagent bar graph. And the neurofibrillary tangles are accumulations of a protein called tau in neurons. Tau collects together and creates tangles in the neurons, which hinder the neurons' functions and cause malfunctions in the brain area. Females average at a higher Braak stage, which implies they have more neurofibrillary tangles in the brain, causing them to have a higher chance of developing dementia. And on the other hand, males on average do not have as many neurofibrillary tangles, meaning they have a lower chance of getting dementia. The average Braak stage graph's p-value was 0.013, which means that the data was statistically significant. And this also suggests a biological sex difference in the development of dementia. So how should treatments change and how should we further research a cure? The neurological differences between sexes regarding dementia have a higher impact on treatments and how doctors should diagnose treatments. Doctors should prescribe medication and treatments accordingly and even take preventative measures, especially for biological females. It is important to note these different methods were used to diagnose dementia, and knowing that they differ between sexes can further inform scientists and doctors about how to advance diagnosis and research. Knowing females have a higher chance of developing dementia, doctors should encourage screening females for the disease earlier in their lives to be proactive. And doctors should also curate specific tests between sexes, testing for sex-specific neurological dysfunction that can distinguish between male and female, and how to treat females earlier as well. And that is it. Thank you.
Thank you. Thank you so much. I have a few questions. What role do you think lifestyle plays in the difference between males and females? Because I assume also like males and females kind of tend to have different lifestyle changes, or is it mostly biological?
Yeah, so I also did research on this. Females are, or biological females are more likely to carry a lot more emotional weight on their shoulders, especially when it comes to things like motherhood, or they're also more likely to be the caretakers for males as they get older. And that is a big, like, neurological stressor that puts on the brain. So that also impacts why females are more likely to develop dementia.
Yeah, that makes sense. Also, females live longer, so I wonder if
Yes, yeah, that
also
too.
why like they literally have the opportunity to develop it more because they also are living longer.
Yeah. Yep.
Cool. Is there anything that, you felt like was unexpected during your research experience that you found?
One thing I found interesting was um, that even though all of my data pointed to females having like higher chances of developing dementia, um, the data was also like two out of my three graphs were statistically insignificant,
Mm.
which is interesting. Like suggests maybe more research needs to be done and more data needs to be put in.
Yeah, I mean, is this something that you're interested in pursuing further?
Yeah, yes, I'm planning to definitely do this for college, and I want um, like specifically, I'm looking for a college that will allow me to do research on this further.
Gotcha. Very cool.